past couple weeks. I've been working 2 jobs because my husband is out of work right now. We had to push back his ship date for the Army until January because he broke his thumb and wasn't able to ship in October when he was supposed to ship. So, let's see, the light behind me is like super bright. So, he's not leaving until January to go to basic training, and then we are moving to California in April now instead of January. So everything's pushed off quite a few months, and it looks like I'm going to be about 8 months pregnant before we move to California, which sucks, but at the same time I don't want to be separated from him when the baby comes, so it's kind of worth it because the only other option would be to stay here and have the baby completely across the country and have to worry about him getting on a plane to make it here in time, and us being separated after the baby comes and all that. So not really liking that option so much, so you know, we'll have to choose option B, which is to move to California when I'm about 8 months pregnant. But my mother-in-law is going to come and stay to be able to help out before and after the baby comes to get us all moved in and set up the nursery and stuff. So what else? So the past couple of weeks have been hectic, like I was saying, because I'm working a lot. As far as the pregnancy goes, everything is pretty good. I will be 11 weeks on Thursday, so today I'm 10 weeks and 5 days. I had my first OB appointment today with the actual doctor, not with my nurse practitioner, and they did a PAP. I've had some spotting for about 4 days from this past Thursday all the way until Sunday night. Monday and today I haven't had any spotting. It's completely gone away. I told my OB about the spotting, and I know what it's from because I do ultrasound, of course, so I'm checking on the baby since I've been having the spotting. And the baby looks fine, moving around like crazy, and the baby looks healthy. I do have a little hemorrhage in my uterus. They call it a subchorionic hemorrhage. And so usually they're pretty common. I mean, they happen in about 1 out of every 4 pregnancies. But still, when it happens to you, it does make you feel pretty nervous. Nobody wants to be bleeding when they're pregnant. But it wasn't really heavy, it was really light, and I knew that it was, you know, probably nothing too concerning. But I told her about it. One of the reasons was just to, you know, let her know. But I worked with her at the hospital, so she knows I do ultrasound, and she asked if I scan myself, and I said yeah, and I told her about the hemorrhage, and she said, of course, you know that's normal, and a lot of pregnancies have that, and as long as it's not really heavy bleeding or anything, it should be fine. But one of the issues was that I am Rh negative. I have O negative blood type. My husband is A positive, which means that I have to have the RhoGAM shot. Usually they don't give it to you until the 2nd trimester, but because whenever you have any sort of bleeding, they get concerned about baby's blood mixing with your blood. It's very rare, but in the rare case that it does happen, they want to be prepared. So I did have the RhoGAM shot today. They do it right in your butt, which is funny because I haven't had one of those since I was a kid. It didn't feel too good. But you know, you gotta do what you gotta do to take care of baby. So there was that fiasco. Trying to think, you know, all my other symptoms have kind of been consistently the same. I haven't had anything new going on. It seems like some of my symptoms are kind starting to go away, because I used to have it first thing when I wake up in the morning, and now I don't have it like that anymore. Sometimes on and off of the day, like if I get hungry and don't eat, I'll feel a little nauseous, but it's nothing like it was before. I still have a couple food aversions, still not wanting to eat meat very much. My breasts are still tender, but not as bad as they were. So I definitely think, you know, I can tell I'm getting close to that second trimester mark. I have about 2 weeks left, so that's very exciting. And I think that's about it. I mean, so far so good. Everything's been looking good with baby, and I've been feeling pretty good. And yeah, I just wanted to update you guys. So that's about it. And I think I will post like one of my most recent sonogram pictures, and also a quick belly shot from today that my husband took. So I think I am starting to show just a little bit now, but not too much. But that's about it, and I hope everybody's doing good. And sorry, this is kind of a crappy car video with the sun all shiny in the background.